Hey there, my name is Hannah Friedman, and I am presenting on high reliability organizations, and I chose to do the Veterans Health Administration, or the VHA. The VA, or the Veterans Affairs, this is a nationwide system that cares for those who have served in the U.S. military. This is any branch of the military, so this can be the Navy, Army, National Guard, any part of the US military, the VA takes care of them and their families. Some of the things that they include is healthcare, but also insurance, education, rehab, pensions, and even housing assistance. Resilience. The Veterans Health Administration has had to adapt to the ever-changing times. This is because the VHA started in 1865, or the month before the end of the Civil War. It has supported veterans in every war in adapting to what the soldiers needed. Examples are World War I, when they opened more hospitals to provide healthcare and rehab to to the veterans that were coming home. Also, World War II, they hired the best physicians as well as they started to work with medical schools to have these professionals learn at the bedside with working with veterans. Next, the Vietnam War and the Gulf War, they focused more on primary care as well as they started on mental health care. Post 9/11, the VA has focused on the whole patient care. So this is where they care for the medical needs, the social needs, the psychology needs. So they started learning about PTSD, mental health, traumatic brain injuries, and even women's health. In 2019, they started the steps to becoming an HRO, or a high reliability organization. Ironically, they started this in 2019 where COVID-19 came, but it reinforced their idea of implementing this is going to take time and that it's not going to happen overnight, but that they want to do it right. They released an evidence brief of how they were going to carry out being an HRO. In this form, they explicitly drew out what they were going to do and how they were going to carry it out. In implementing the HRO, they brought the five HRO principles: the sensitivity to operations, preoccupation with failure, reluctance to simplify, commitment to resilience, and the deference to expertise. As an HRO, they followed eight different frameworks to create their own. The eight different frameworks that they used was the Joint Commission's High Reliability Healthcare Maturity Model, the Institutes of Health Improvements Framework for Safe, Reliable, and Effective Care, American College of Healthcare Executives Culture of Safety Framework, the Johns Hopkins Armstrong's Institute for Patient Safety and Quality. They use two frameworks, the Operating Management System and the Safety and Quality Framework. They also use the Office of the Air Force Surgeon General's Trusted Care Framework, Advancing Research and Clinical, and then they practice through close collaboration model, so the ARC model. Um, the strategies included developing a leadership, a culture of safety, data systems, training, learning, and implementing interventions. But while they were looking for the different frameworks to create their own, they had some complementary practices that they used as well. So the incorporation of justice, equity, and patient-centeredness. This is key in building a culture of safety. It values diversity, inclusion, which helps eliminate disparities in patient care. Next, involvement of a variety of stakeholders involved in the healthcare delivery, including patients and families. This values what the patients and families experience and how the healthcare is administered. This is how they continue to make change and progress in the quality of care that they give. Next is assembling transdisciplinary teams. This isn't interesting because they focus on bringing team members throughout the hospital together to learn from each other. So having professionals from the emergency room go to the ortho floor to learn about their safety huddles, or vice versa, or even the psychologist or the psychiatric care go down to the emergency room to learn their practices. And it's just another way of how they try to bring everybody together to make sure that they're providing the best patient-centered care, but also to learn. I feel like personally working in the healthcare field and you have a specialty, you focus kind of on that specialty. You forget that there's a whole other part of healthcare that you're missing out on. So kind of bringing them together helps them remain on the top tier care. Next, they utilize change management strategies such as the Lean Six Sigma to promote change. The Lean Six Sigma is a root cause analysis, and they use this to kind of find out what events were happening. Are they occurring often? Was this a once in a blue moon incident? They use this to kind of figure out the cause and how to change that so that it doesn't happen again for future tense. Process improvements. Since 1999, they have collaborated with the Institute of Healthcare Improvement to enhance the process improvement of their facilities. 2006, they established the VHA Systems Redesign Program Office to facilitate waste reduction throughout the hospitals and the organization. In 2017, the organization adopted a national standard for redesigning systems and improvements. Once again, just constantly improving the processes that they already have. 2019, they initiated the HRO process, identifying zero harm as their motivation for enhancing improvement and patient safety. Once again, they started that in 2019 during the COVID pandemic, and they identified that they wanted to be a part of the HRO and um, give the best patient-centered, safe care. Quality improvement. For quality improvement for an HRO in the medical field is to improve processes for effective, safe patient care. The VHA has a group called Quality Enhancement Research Initiative, or the Query, where they conduct evidence-based research to improve the veterans' healthcare. The group assesses the implementation and reviews the findings to make sure the initiatives are best for the patients, while recognizing and utilizing the five principles of the HRO, which once again are the sensitivity to operations, preoccupation with failure, reluctance to simplify, commitment to resilience, and deference to expertise. They also implemented the Standards of Quality Improvement Reporting Excellence, or the SQUIRE 2.0, standards for reporting implement studies, the STARI, and the template for intervention description and replication, or the TITRE. And basically what those are, they are reporting tools for them to kind of monitor on their implementation processes to improve the quality of the care that they're giving. So they have to collect the data in order to see what they can improve on to make sure that the quality is the best and top tier that they can. And the final points of wrapping up this, the VHA has been around for many years. I mean, going back to Civil War times, and it's been on the front lines of all the different changes that the United States has seen, but also the world. This organization's resilience in growing with the times allows it to provide the best, most competent, and safest patient care to veterans who served this country. And finally, these are the references that I used, and I hope you enjoyed my presentation.